Hello, I'm Sergides. I'd just like to introduce myself. I look after patients with a wide range of spinal conditions such as neck pain and arm pain, or low back pain and leg pain, and I'd like to share one interesting case with you. This is the case of an elderly gentleman with a progressive sagittal plane deformity which was severely affecting his quality of life. He had had a posterolateral fusion at L4-5 in the previous year and a half and had progressively become more kyphotic over that time. This is his CT scan showing a sagittal reconstruction. The screws at L4-5 are out of view, but one can see an osteoporotic crush fracture at the adjacent segment at L3. This picture demonstrates his MRI scan, again showing the osteoporotic fracture causing a severe canal stenosis. And this is an X-ray called an EOS scan, an X-ray designed to look at a patient's posture and can demonstrate a patient standing in one film without the need to stitch 2 or even 3 films together. So we can see the L4-5 instrumentation, and we can see that in the sagittal plane there is a gross deformity and the patient is essentially looking down at the floor.
It's surprising how your body becomes completely unstable when the weighty head is somewhere in front of you and not sitting up on your shoulders. Well, everything became a struggle because of the fact that I was bent over to such an extent. If I was walking anywhere, I had to keep lifting my head to see if I was going to collide with someone. It was very, very awkward. And because of my head being in that position, I was totally out of sync, and I had numerous falls. I'd get up from a chair having dinner and fall over to drop a handkerchief, and some of them were really nasty ones. It was a major headache, and I knew that if I continued I'd end up in a wheelchair. It was inevitable.
So I've calculated that this patient requires at least 60 degrees of correction of his sagittal plane deformity. And this can be achieved by removing a wedge of bone through 2 vertebrae. The first vertebra which I'll choose is L3, and this is just showing the angle of the osteotomy. And the next vertebra which I'll choose will be L1. This is the bottom of the pedicle. These 2 osteotomies together will achieve approximately 40 to 50 degrees, and the remainder of the deformity can be corrected by removing several of the facets between the upper thoracic spine and the pelvis. 9 months post-operatively, we can see that the patient is standing in an upright posture which is sufficient for him to carry out his routine daily activities, and fortunately he is free of any pain. And this picture demonstrates the patient pre-operatively and 9 months post-operatively. And this is the same image but from the side.
Well, certainly I feel very much as if I'm back to normal. I can drive without any problems, and life is very, very much back to normal as far as I'm concerned.
Of course, this is an extreme case, and most cases can be treated with relatively minimally invasive surgery and short lengths of stay, and of course, even without surgery altogether. So if I can be of any assistance, please don't hesitate to give me a call.